How to combat sitting. Alright guys, so listen here, sitting is the new smoking. How many hours are you sitting a day? I want you to really think about this. How many hours, when you're at work, I want you to count these up. When you're at work, how many hours are you sitting at a desk? When you get home, how many hours are you sitting at your computer? How many seasons or shows on Netflix are you watching? Or if you're just lounging on the couch, hanging out, how long are you doing that for? And then I also want you to think about the gym. If you go to the gym and you're constantly sitting on machines and you're not really ever on your feet, how many hours are you at the gym just sitting? Sitting and working out, sitting and doing this, keeping your hips in a flexed position, all right? I want you to add all of these hours up, okay? Now, sitting for extended periods of time can affect our bodies in a few ways. It can give us low back pain, it can give us hip pain, it can give us knee pain, ankle, foot pain. All right, and this is a result from just sitting from hours and hours. All right, so next we're going to talk about the psoas, also known as your hip flexor. This guy attaches from your femur all the way into your low back, last few thoracic level T12. All right, when we sit, we are shortening this hip flexor, and anytime that we shorten any muscle for long periods of time, it eventually stays shortened, okay? And this is where our body gets comfortable, and when we have a muscle such as our hip flexor that stays shortened, it's going to affect our pelvis, right? It's going to have our pelvis tilt in a forward motion, right? And then from there, our body's actually going to compensate for a shortened hip flexor. And then the ripple effect happens. Our back starts to change alignment. We start lengthening, shortening other muscles to balance our current state. And it's going to start to affect our neck, our hips, our knees. And the next thing you know, you have aches and pains everywhere, and you start to live in a state of compensation. All right, living in a state of compensation increases our risk for injury, and this is not only going to affect our quality of life physically, but mentally as well. All right, so what I'm going to do is I'm going to give you a few exercises that you can do every day to offset your long hours of sitting, and they take very little time to perform. Start applying these right away, stay consistent, take notes on how you feel, and 3 to 4 days in, I want you to kind of take a mental assessment, right? Less back pain, less knee pain, less hip pain. If so, that's the goal. All right, let's do it.